We are in Uganda. Well, here we are in Uganda. I'm Dr. Robert Frantz, and I just got off a safari, and I'm stopping here with my colleague in Kasambya, Uganda, who runs the medical clinic here. His name is Binaisa, if I pronounced that correctly. And we're collaborating with the medical clinic and a research project here. And before I talk about that, maybe you could just tell us a little bit about yourself and how you came to be manager of a clinic and maybe your goals in the future.
I'm Binaisa, as you have said. I'm the in charge and the director of this medical clinic. It's called St. Francis Medical Center. We have been working with this clinic for the last 4 years, and I'm working with 2 clinical officers, 2 nurses, 1 nursing assistant, and a lab technician, plus other support staffs. This clinic was initially formed because of the medical needs of the people in this area, because medical services were very poor and inaccessible, and that's the reason why I decided to actually come in, mobilized my colleagues, and then we started this medical clinic. Basically, it is a rural medical clinic for the disadvantaged people, for those people who really can't afford long distance travels, high charges of travel seeking for medical services.
Well, let me ask you, can I ask you, I understand you're going to plan to go to medical school.
Yes.
When does that start and where?
Yes.
When will it start and where will you go to school?
Well, I was admitted to Kampala International University, and I'm expected to start in January this coming year. And since we have a clinical officer here and the senior nurse, they are supposed to continue running the medical clinic just as it has been running, and as it runs when I'm out for conferences, seminars, and workshops. And they will actually continue running the activities of the project along with the healthcare provision.
Mm-hmm. Well, we very fortunately came together through a mutual friend here in Uganda, and he connected us, and the reason we're looking at this clinic to help us is we had a international conference on healthcare management at Washington University this last spring, and at that conference I learned about the use of software called GIS, or Geographical Information Systems, and how it was used in Haiti in the post-earthquake there to better understand evacuation and other problems they needed to resolve in the future. Well, I got thinking that I'm very familiar with another software package for sociological research, qualitative research, called In Vivo 9. And so it occurred to me that the integration of these 2 softwares could be a very powerful tool in dealing with eradication of serious diseases. And the disease we picked here was malaria. Could you tell us just briefly how bad malaria is here, and what percentage of your patients?
Well, actually, the malaria cases in our area is a menace. It is actually one of the greatest problems we are facing, actually, that we even think must be associated with the poverty levels of this area. Actually, malaria cases counts for about 60% of the total patients received at this clinic, and out of all those, more than 50% are children below 5 years. And because most of the patients we actually handle come from long distances and are majorly low-income earners, actually as it is a very big problem, especially when the patient reports late and you have to involve probably referrals for blood transfusion, and actually most of them end up dying. But we're actually struggling. Our struggle is that really we extend these services so widely that we cover these patients actually to a large extent. And actually that's the reason why I even think of actually extending my medical training so that we can actually widen our scope of service and handle these cases so seriously.
Okay, and well, just briefly, the way our research will work, and by the way, we're doing parallel projects in India and Peru to give us reliability checks on what we're doing here. But with the geographic information system, and we're using ArcGIS 10, we can actually create a mapping of the area here, and then based on the patient's address, we can discover if there are density pockets of malaria, or what we call hotspots. And then on the qualitative side, we'll be conducting surveys of all the people, and that way we'll know that those in the hotspots, we'll know all about them, their attitudes, beliefs, education, and we'll try to see if there are some relationships that could be useful in knowing and coming up with least cost programs to try to eradicate the malaria. This research is now commencing. We're starting to get the survey data, and so we hope that maybe in a few months we can start to see a clear picture of what's happening here, and then we'll report it in a paper next spring at IST Africa in Tanzania. So, malaria, I'm not a medical practitioner, I'm more of a technologist, but as I study malaria, I feel so bad about how the disease affects the children, and I understand that those that do survive can be affected in their mental capabilities or have other lasting problems. Could you talk about that or describe it?
Actually, most of these malaria cases, when we call them severe episodes, when a severe episode of malaria attacks a child, it's believed that actually these young children still have their brains forming and developing. So when they get severe episodes like involving complications like severe anemia, severe convulsions, which involves it really leads to the brain damage, which actually imparts long-lasting damage or incapacitation of these children. And actually, one of the greatest complications is actually brought about by conversions, which it may even cause to future epileptic attacks to these children, brain damage, and even poor performance in the future. Maybe in schools, you find the person is incapacitated, can't study, can't do other personal activities because of this malaria. And most of these children actually originate from poor families who cannot even afford to offer special education needs to some of these children after these effects of the malaria attacks.
Well, I look forward to achieving results and reporting back to everybody around the world on YouTube and through our videos, and I wish you, I certainly hold the greatest respect for you and the work you do and your goals, and as getting a medical degree, and I think that we're going to hear great things from you in the future. And I'd like to thank you very much for having a great dinner here for us and meeting everybody, and hope to return hopefully next spring maybe, and see you again. So thank you very much.
Thank you.